Hi, and welcome back to FitMed. Today I'm going to be trying a little bit of a new process, as this is a channel where I'm trying to evolve my presenting skills. So bear with me and let's see how this goes. Today I'll be talking all about hyperthermia. Now this is where the body gets excessively hot. So I'll be discussing the mechanisms that control the core body temperature and how they go wrong in the context of exercise. And to finish, I'll tell you all about what you need to do if you come across someone with hyperthermia and how to manage them until help arrives. So, let's get on with the show. Hyperthermia can be broadly classified into three main categories. The first being heat cramps. Now, these are not normally accompanied with a rise in core body temperature, but can be an early warning sign of that potentially occurring. Now, heat cramps typically involve muscle cramping. These are brief, painful, involuntary contractions of the muscles due to localized muscle fatigue and electrolyte disturbance. Typically, these are temporary and will resolve following fluid intake, electrolyte rebalance, and rest. The second type of hyperthermia is heat exhaustion. Now, this is typically categorized as having a core body temperature between 38 and 40 degrees. Now, this can go a little bit either way with the definition of heat exhaustion, as its diagnosis is primarily based on the symptoms and the history leading to those symptoms. Now, the symptoms most commonly seen at this stage are a headache, thirst, muscle weakness, anxiety, feeling a bit dizzy, and can lead to fainting. It is quite likely that most adults will experience some of these early symptoms of hyperthermia at some point in their life. However, at this stage, your mental status is still intact, so you're more able to remove yourself from the environment and go seek some cool area or a drink, so you don't go to the excess of some of these symptoms at this stage. And thirdly is heat stroke. Now, this is the most extreme end of hyperthermia and is typified by a core body temperature in excess of 40 degrees. It is at this point you start to get central nervous system dysfunction, and you're most likely to develop anhidrosis, which is the inability to sweat. It is quite likely at this stage that you start feeling a bit more agitated or irritable, even lethargic. You start developing ataxia, which is an inability to coordinate, and you become at high risk of seizures. At the most extreme end of symptoms, you can have an altered level of consciousness, you could be confused, go into a coma, and ultimately result in death. Keeping this in the context of exercise, regardless if you're in a hot environment or not, whenever you start exercise, you will stimulate a sympathetic nervous system response. Now, this causes an increase in heart rate, respiratory rate. The body tries to keep the blood very central, so you get peripheral constriction of the blood vessels. But you also get a stimulation of the sweat glands of the skin, primarily the eccrine glands. Now, this response is not as potent as that stimulated by an increase in core body temperature, but it happens nonetheless. Now, those eccrine sweat glands primarily respond to thermal stimuli. There are central and skin thermoreceptors that, when are triggered by increases in temperature, send a signal up to the preoptic center of the hypothalamus, which then triggers a pseudomotor response that increases sweat production. Now, both the sympathetic nervous system and this response are autonomic nervous system responses. The sweat on the skin allows the evaporation of water, allowing the cooling of its surface. And this is why sweating helps us to regulate our body temperatures, as it helps to remove heat. Now, this could not be done unless the hypothalamus also initiates the increase of circulation to the skin, overriding the initial sympathetic nervous system response. Now, this allows for increased dissipation of heat from the skin via radiation, and this occurs as long as the external environment is cooler than the skin surface. This works most effectively when sweating is working well. The body is very efficient at dissipating heat. Considering that 60% of the energy created in our body is heat, it has to be. And during exercise, our energy conversion rates go up exponentially. Now, the mechanisms that go wrong during exertional heat stroke are related to an inability to sweat and an inability to radiate heat. Dehydration is the primary risk factor for exertional heat stroke. Your body will try and preserve any fluid centrally to try and maintain blood pressure and tissue perfusion. So a lack of sweating can be a key sign of heat stroke, although that is not always the case. Another factor that can affect the ability to sweat is sunburn. Now, sunburn is an inflammatory response to UV rays, and where there's inflammation, there's swelling, and if there's swelling, there's compression of the sweat ducts. Now, both of these mechanisms result in symptoms such as a red, hot, and dry skin, and this is quite an ominous sign of heat stroke. Now, factors that affect your ability to dissipate heat are mostly based on your environment, whether local or general. Now, if your general environment is hot, humid, and is greater than that of your own core body temperature, then your ability to radiate heat is diminished, as in fact the heat will start to radiate into the body. The other factor I mentioned is your local environment, and by this I'm talking about the things that are touching your skin. So if you're a firefighter, you've got big, thick, heavy-duty clothing to prevent you from burns from the heat outside. Now this is thick, it's also heavily insulated, so this prevents conduction, so heat loss through touch. It also prevents evaporation, as you've got water on your skin that's not able to evaporate away, and it also impairs radiation. We particularly start to worry when the core body temperature reaches in excess of 40 degrees, as it is at this point there is irreversible neuronal damage that is particularly sensitive in the cerebellum, and this damage only increases exponentially with any increase in temperature above 40 degrees. Now this, alongside the increase in temperature, can increase the permeability of the blood-brain barrier. Now this increase in permeability allows in toxic metabolites and other substances that can increase the fluid crossing the barrier, causing cerebral and cerebellar edema. Now this damage to the brain is what causes the central nervous system dysfunction that is typically found when temperatures exceed 40 degrees. There are other symptoms with extreme hypothermia in excess of CNS dysfunction that include tachycardia, renal dysfunction, and liver dysfunction in response to the heat. Now these symptoms are primarily due to the redistribution of blood. Now with the increased peripheral distribution of blood to the skin, there is a reduced venous return, which reduces cardiac filling and reduces stroke volume. Now this causes cardiovascular strain, and this is why you get the tachycardia. As blood is shunted away from the skin, it has to draw the blood supply away from the other organs, such as the liver and the kidneys, and this is what leads to an acute kidney injury or acute liver failure. Although this redistribution in heat can cause acute liver failure, it is actually the heat that causes clotting factors to stop working. With the increase in core body temperature, there is now a risk of internal bleeding due to disseminated intravascular coagulation. With the redistribution of blood, there are various areas of the body that become ischemic. This means they are lacking oxygen, and this causes stress. This initiates the release of cytokines, which are chemical messengers that induce the inflammatory response systemically. And alongside disseminated intravascular coagulation, this can start to lead to end organ failure and ultimately death. All this combined is what creates this picture of thermoregulatory shock. And this is why hyperthermia is so dangerous. Exertional heat stroke is one of the leading causes of preventable non-traumatic injury and death in sport. There are several American footballers who have died over the last 20 years due to heat stroke, due to the fact they have to wear these big pads which impairs their ability to dissipate heat. I have actually experienced heat exhaustion, fortunately just stopping short of heat stroke. Now this was during a time where I was at university doing sport and exercise science, and I was participating in an experiment whereby we had to cycle for an hour in a heat tent that was kept at 30 degrees Celsius. We were not allowed to drink before the experiment for 2 hours, and we were not allowed to drink during it. And our fluid losses were monitored by weighing ourselves before and after the experiment. Now, it was determined that I lost 500 mils in sweat in 1 hour, which is quite low, but I am myself just quite small. It might be I just don't have a very high sweat rate. Or it might be the fact that I was starting to have a deterioration in my ability to sweat, because I certainly wasn't feeling very well in the last 15 minutes of the experiment. So to monitor our health, we had skin and we had a rectal thermometer as well while we were cycling. Don't ask how we did it. It did. But unfortunately, the rectal thermometer actually fell out about 20 minutes before the end. And the last reading was 38 degrees, so my core body temperature reached 38 degrees. And as we've spoken about, that is considered to be a point where you start experiencing heat exhaustion. Now, I carried on for the extra 20 minutes to the end of the study, and I was feeling awful in the last 15 minutes. When I came out of the heat tent, standing next to the other person who also did the experiment next to me, I was scarlet. I looked the colour of my all-in-one that I was wearing, which was burgundy, and I wasn't sweating. I was quite unwell. I was very, very dizzy. I walked home. I felt very nauseous. Unfortunately, I didn't vomit. But I was a good scarlet colour for a good 2-3 hours after the experiment. And I had a huge headache. I was pretty much done for the rest of the day. I sincerely hope no one ever experiences this, and I have fortunately not experienced anything like this to this extreme again. Now, people who are most at risk of hypothermia are, of course, athletes. This is because they're often exerting themselves and creating a lot of heat in hot environments, which is why we heard a lot about safety in the most recent Olympics in Tokyo and Paralympics in Tokyo. However, it is not just athletes that experience heat stroke. There are some professionals where you need to be minimally exerting yourself to suffer from heat stroke, and that is due to the equipment and personal protective wear that you have to wear. So it was very much well publicised last year about NHS workers having to wear level 4 PPE and suffering from heat exhaustion. That is actually a common occurrence if you have to be fully covered and you're in a warm environment and you're not able to dissipate your sweat, you're not able to dissipate your heat. It was only earlier this year, I believe, there was a soldier that died from heat stroke, or at least there was certainly one in the last couple of years that did so in the UK. It's also because they're wearing kit that doesn't allow for good evaporation, and they're having to wear heavy bags that can increase the amount of energy required, which increases heat production. So exertional heat stroke primarily occurs in younger adults, athletes, and those who exert themselves in heat. There is also another classification of heat stroke, and this is called classic heat stroke. This type primarily affects the elderly, those with reduced cognitive function, those with neurological disorders that can impair the thermoregulatory physiology, such as those with spinal cord injuries that can reduce your ability to initiate sweat responses or direct blood to the skin. So they have an inability to dissipate heat very well. Those who are not acclimatised to hot environments can be affected, even without any exertion. If you're already dehydrated and in a hot climate, you can experience heat stroke. If you're obese, you can experience heat stroke even if you're sedentary. This is because you have a reduced surface area of sweat glands over the skin, as you do not produce any more sweat glands beyond the age of about 3 to 4. So as you grow, your sweat glands sort of travel with your skin. So someone who's quite small like myself probably has quite a dense coverage of sweat glands. I should know this, I do sweat a lot, as can be seen from a lot of my previous videos. There are also some medications that can increase your risk of classic heat stroke, and those include diuretics, beta blockers, anticholinergics, antihistamines, antipsychotics, and antidepressants. A lot of antis. There are different mechanisms by which these medications can increase your risk of classic heat stroke. They can increase your risk of dehydration, they can decrease your ability to dissipate heat, and they can cause an alteration in the set point for core body temperature. If you're going to be exercising in the heat for greater than 45 minutes to an hour, you really need to make sure you replenish your fluids via an isotonic drink. This is where the electrolytes are in balance with that of the blood. Now, if you have a hypotonic drink, such as water, this can actually cause a bit of an osmotic draw into the wrong places in the body, as it results in electrolyte disturbances. And this can put you at increased risk of pulmonary edema as well as cardiac arrhythmias. And this can actually lead to death, and actually there's been more deaths caused by this in marathons than heat stroke. If you notice you've stopped sweating, it is imperative that you stop exercising immediately. You need to go find a shady, cool spot and find some drinks to replenish your fluids and electrolytes. You should wear loose and light clothing in the heat. Although these big clothing tech companies sell their clothing based on these water-wicking lycra, If you are not sweating properly, then actually the tight clothing can actually impair your ability to radiate heat. Whereas a nice loose and light clothing can allow wind to circulate, a nice little local breeze, and allows that evaporative process, but also allows you to radiate heat out a bit easier. Monitor the weather conditions. The peak times for heat during the day are often following midday until early evening. So the best time to exercise are usually in the early morning or very late evening where it's cooler. If you have just travelled from a mild to a hotter climate, you need to spend the first 8 days acclimatising. So this means not spending more than 1 or 2 hours in the heat each day for those 8 days. Following an injury, avoid heat exposure for at least 24 to 48 hours, as the inflammatory cascade that injury induces can increase your risk of hypothermia. The best advice I can give about avoiding hypothermia is to avoid exercising in the heat. However, as sporty people, we kind of know that's not going to happen. So the best thing to do is just to try and do your best, follow the previous advice I've given, and if you do feel unwell, to seek help where you can. And now comes to my favourite part. This plays into some of my paramedic training, as well as my medical training, as well as my interest in sport. So the first thing you need to do is your doctor's A, B, C, D, E. Now, when I was a kid, it was just Dr. ABC, but things have improved since then. Now, first of all is your D, danger. The first thing you do if you see someone in distress, before you do anything else, is look to see if it's safe for you to approach that person. The last thing we need is 2 people who are injured. Now, the next thing to do is R. Are they responding to you? So approach the person who's in distress and talk to them. Are you okay? Now, if they're able to verbally respond to you, make eye contact and move or wave to you, then they're already meeting the 3 categories for someone who is alert. If they are not able to do any one of those things, then they have a reduced ability to respond. If they have a reduced ability to respond, it is important that you call 999 immediately. This is your S. Shout for help. If you can get help from close by to call for you, that is even better. Now, while you're waiting for the ambulance to arrive, there are things that you can do to try and help that person in distress if they are in fact suffering from hypothermia. So firstly, your A, B, C, D, E management. A, airway. Are they able to maintain an airway? If they are, move on to B, breathing. Are they breathing? It is highly likely in states of hypothermia they're going to have a fast breathing rate. Next is C, circulation. Just because that person is bright red, as we've established, blood can be redistributed to the skin away from the vital organs. So don't be reassured that just because they're bright red, that'll mean that they've got a good circulation. Next is D, disability. You've already assessed their ability to respond to you. Now, in the pre-hospital setting, we'd also be checking their blood glucose. However, as a bystander, there's not actually much you can really do in this category apart from trying to make sure they stay awake. And finally, there's E, exposure and environment. It is important that if you're suspecting that person is suffering from hypothermia, to move them out of direct sunlight and into a cool and shady area. It is also important to remove any clothing that might inhibit their ability to radiate heat. So if they're wearing a big heavy jacket, or if they're wearing multiple layers, try and reduce them down to the minimum layer as much as is dignified for that person. Now you've completed your primary survey and management, it is really important that you start your rapid and active cooling. You do not want to leave that person on their own, so only do the following if you have someone else on hand that can retrieve the items required. Now, if you're at a big sports event, it's more likely that they're going to have things like ice baths and just cool water that they can use to rapidly cool that person down, as heat stroke is a time-critical condition. If it is safe and practical to do so, you should immerse the whole body within these cold water baths. Now, as a bystander, it is unlikely you're going to be able to get hold of a cold water bath with some ice, or have a compliant person who's going to get in that bath. So the next best thing you can do is to wet and fan the skin. You can also wet ice packs and apply that to the skin as well. So get out your frozen peas. While you're waiting for that ambulance, the idea is to perform rapid cooling, as it is not safe for that person to have a core body temperature above 40 degrees Celsius for very long, as damage can occur very quickly. And reflex hypothermia is not very common. but ultimately it is getting that person to a hospital quickly, which is your primary goal. If any of what I've mentioned previously will delay this, then please don't do it. Just get that person to a hospital. So that concludes today's video. I hope you've learnt a lot and you've enjoyed this slightly new format. Probably not noticed any difference, but I've tried giving it a go. So next time I'll be talking about the opposite of today's video, which is hypothermia, its effects on exercise and what you can do if you come across someone with hypothermia. You can follow me on Instagram at lexi_fitmed, and remember to like, subscribe and ding that bell if you want to be the first to know when the next video drops. Thank you for watching. I hope when you next come across someone with hypothermia you'll know what to do, and I'll see you next time on FitMed.